Welcome to Mental Health and Science with Birabi Enock Francis. In today's video, I'm going to teach you about epilepsy. And if you are a health worker, you're a student who wants to know more about epilepsy, this is your chance to learn more. But also if you are someone from the community, you have someone who has epilepsy, you have seen some of you have people in the village who have epilepsy, this lesson is good for you. Please watch until the end, and I believe you'll get a lot of knowledge from this subject. So from the beginning, we have to understand what's the meaning of epilepsy. So epilepsy is a neurological disorder, or is a sickness which originates from the brain. But to put it simple, it is a sickness which is characterized by what we call recurrent seizures. Okay, so someone gets attacks which makes that person to fall down. Some of them can lose senses, but they come. For example, if they come today, you may find that they may spend maybe like 2 days, then again they reoccur by themselves. So a seizure, a definition of a seizure is it is not epilepsy, but it is a disturbance of the body, okay, in behavior. That is a seizure. So epilepsy is that sickness which is characterized by recurrent seizures or attacks. Okay, so we have different types of epilepsy, and different people have named them accordingly. There is what we call the International League Against Epilepsy. So they classify epilepsy in different ways, but in this video I want to make each and everything simple for you. So we have two types of epilepsy. There is what we call the convulsive type and the non-convulsive type. So the convulsive type is where you find someone falling down and shaking. Okay, when someone shakes, they can shake this side of the body, this hand. You'll find maybe it's the one which is affected, or it can be the whole body, whereby you find someone is shaking when he's getting the attack. Okay, that is what we are calling the convulsive type. So there are other signs and symptoms that you can see with a convulsive type. One of them is some people can bite the tongue as they are convulsing. Others can urinate in their clothing. Others even can defecate in their clothes. That is the convulsive type. So someone may not have all the signs, but he can have the one of them is falling, like from nowhere they lose their consciousness or they lose their senses, and they find them what? And falling. That's what we are calling the convulsive type. Now, the non-convulsive type is whereby someone does not lose their senses. I mean, does not fall down, but he loses senses. Okay, so if you are maybe someone is in class and you call them maybe Jen, you find they are not responding, but then later on they respond. Okay, if someone is having, for example, this pain and maybe they're having the non-convulsive type, you'll find this object will drop out of their hand. Okay, why? Because they have lost their senses. So that is the what we are calling the non-convulsive type. But on the other side, if you are a student, we are talking about classification. There is what we call generalized tonic-clonic seizures. These are characterized by someone convulsing. Of course, when you are convulsing, the hands become stiff, and this one, they move this side. So that's what we are calling generalized tonic-clonic. Okay, that is describing the movement of your muscles. So then we have what we are calling absent seizures. These are the ones which we are talking about as under the non-convulsive type. These are where you are just losing the senses, and these ones are so much common in the what? In the women. Then also, what are the causes of epilepsy? Okay, research has showed us that the majority of the people who come to the health facilities or in a mental health facilities, 60% of them, the cause is unknown, or we could call it idiopathic. Okay, so we may find and look around, we find that this person has no what? This the cause. We cannot trace what has caused this epilepsy, and but the treatment is available. Then another one is genetics. Some epilepsy moves can be transferred from families. So you find that if your relative or close relative had, maybe you had someone who had epilepsy, you may find that this thing has moved in blood, and also can be transferred to someone else. Then also we have head injury. If you get an accident and your head is damaged, you may find that it may damage some part of the brain, whereby you find that the brain sends what we call abnormal messages, because that's what makes epilepsy. Epilepsy is where the brain is sending abnormal messages, which keeps making a person to fall down and lose senses. So head injury can bring that. And also we have what we call infections, like severe malaria. If you have seen in the children who get cerebral malaria, they can get attacks of epilepsy. We call them fiber convulsions. This later can turn into what we are calling epilepsy if they are not well treated. So sickness like meningitis can also go to the brain, affect the brain, and lead to what we are calling epilepsy. Then we also can have people who have swellings within their brain, like there are those people who have what we call tumors. If that swelling is there, can also affect the brain, and you find the brain sending abnormal messages, which keeps making someone to fall down. Then another thing, maybe it will be the last among the causes, is substance, alcohol and substance abuse. You know, these substances, when we take alcohol and others, they affect our brain. So you find that people with the alcohol abuse, they can also develop epilepsy in their late ages as they are taking the substances. So those are some of the causes that I can give you, which bring epilepsy. And let us also look at the diagnosis. When can you diagnose someone with epilepsy? When can someone be considered to be having what? Epilepsy. So epilepsy, to diagnose someone with epilepsy, one of it is that you must rule out the physical illness. Okay? You have to do thorough history assessment. You have to find out the frequency of the attacks. How long does this person get attacks in a week period of time? How many does he get? How many seizures does he get? In the morning? Is it in at night? And also you have to look at the onset. When did this seizure start? Okay, this one is very important, because also someone may be having a febrile illness which has increased the temperature and starts convulsing, and you call it epilepsy. So you have to determine the period. Helps you ruling out those infections like malaria, helps you so much. So to someone to be considered to be having epilepsy, someone at least in a calendar year must have got 2 recurrent seizures which are unprovoked. What do we mean unprovoked? The seizures must occur by themselves. Okay? They should not be due to high fever, maybe because of an infection. Okay? They should not be because of that. They should come by themselves, so that when you go to test someone for malaria, you find malaria is not there. When you go to test for other infections, maybe bacterial infection, you find it's not there. You look, someone does not have this other infection, someone doesn't have this other physical illness. So when you have 2 recurrent seizures within a calendar year, then you can diagnose you as having what? Having epilepsy. Then what about these children who get what we call febrile convulsions? Okay, so febrile convulsion is not epilepsy, but if the condition is not treated, like as we call it, febrile, high temperature. So high temperatures in children due to infection can cause what? Seizures, but doesn't mean that it is epilepsy. So later on, if they are not managed, this child can develop epilepsy later in the what? In life. So in most cases, many people in the community ask me, which kind of test can we do to confirm that maybe my child, my wife, my daughter has what? Has epilepsy. Okay? So one of the tests that doctors recommend or we always do, but I always don't do it for my patients, but it is when maybe it is from the history, it is the brain CT scan. Okay? When you do the brain CT scan, for example, if someone, for example, has gotten a head injury, we can do a brain CT scan and find out which side of the brain is affected. Okay, so a brain CT scan, we recommend it for someone who has got a head injury to discover which part of the brain has been affected. But in case you don't have you have never gotten an accident, these things are happening, as me as a doctor, I will not recommend you to do a brain CT scan because it will come back normal. Okay, then another test that we do, which costs around 30,000, it is called EEG or electroencephalogram. This is a test which tests the brain activity. Okay, when they put the electrodes on your brain, so they want to know the electrical activity. How is the brain bringing up that activity within your brain? So that test is used to confirm which side of the brain is affected. So in simple words, this side of the brain controls this other this other side of the body. Then this other side of the brain also controls the right hand side. So when we are doing the EEG test, we want to confirm which side of the brain is affected. So this one also helps us to confirm the type of seizures that you are experiencing. In most cases, you may find that the electrical activity, like you find those things overlapping. Some of you have been given tests by the doctors, and you find on the test you show they are overlapping. That one shows that there is abnormal discharges within the brain. So those are some of the two tests that we do. But these other ones are general, like malaria tests, you carry out maybe HIV tests, all those ones are just general. But this specifically, these two, the brain CT scan and the EEG test can be done to confirm that you have you have epilepsy. Then epilepsy is a disease that is treatable. Most people ask me, how long am I going to take medication? Okay, so depending on the cause, according to the research says, if you take 3 years without getting an attack, then we can remove you from medication and we monitor you for some times. If the seizures again come back, then we have to put you on medicine for for life. But in most cases, in places like Africa, it is very hard because if I'm the one who has initiated you on treatment, you find that you'll find another doctor who also going to to give you the treatment. So we have different kind of medication that we give our patients, and we call them anticonvulsants. They have different side effects. For example, carbamazepine, it can cause some darker skin. We call it Steven Johnson syndrome. Some of them can cause dizziness, can cause headache, but depending on the patient, people react differently. We have also things like sodium valproate, but this one is it is not recommended in women of reproductive age because it can cause fetal or malformations, like you produce a child with congenital abnormalities. So we don't recommend it giving it to females of reproductive age. Then lastly, as I finish my video, is that epilepsy can be treated. And when you take your medicines very well, the seizures or the epilepsy can be controlled. But when you leave your medication, some of it the severity, you can also get complications, what we call status epilepticus. Status epilepticus is a condition where you have recurrent attacks. For example, after every 1 minute, you are getting an attack. After every 1 minute, you are getting an attack like for about 30 minutes. So that one is an emergency. If it's not attended to, uh, you can die. So epilepsy is treatable, and as I told you in my previous videos that you cannot get epilepsy by touching someone, because we have said that it is a brain which it is a disease that comes from the brain, where the brain is sending abnormal what messages. You cannot get epilepsy by touching someone's saliva or by sharing the food. That one is very false, because as it is something which is coming from what? From the brain. So if we have our family members in our communities, let us support them. Let us not lock them in our houses. Let us support them, bring them to hospital for management, because if you bring your patient early or your relative early, it is easy for us to manage. But if you leave those people, you find they have multiple scars. Some of them will drop out of school, and when you bring us at the later age, you find someone can no longer continue. Even in children, you find a child has lost speech, can no longer talk. A child was born normally, but this child can no longer what? Can no longer talk. So my name is Birabi Enock Francis, and I am a psychiatric clinical officer. I treat people with mental health issues, and one of the people that I treat are people with epilepsy. So if you have any relative, or if you have any question, you can write for me in that comment section, and I'll be glad to support you. If you have any relative who is having that problem, we can still connect wherever you are. Online nowadays, we have online therapy. We can contact me through my email account, my WhatsApp number on that my YouTube channel. And I request you that if you are still new, please subscribe to my channel, like, watch, and share with your social network, because this motivates me to make more videos. And see you in my next lesson. Thank you so much for watching.